Welcome, everyone. Again, my name is Ashley Klein-Jimenez. I am with Prevent Connect and the California Coalition Against Sexual Assault, and we're really excited for this conversation today. So we are just going to go ahead and jump right in because we have a lot to get to. So this is your Prevent Connect team. Before anyone gets concerned about my risk of salmonella, my friends at CDC have informed me I should not snuggle my chickens, so don't worry about that. David is not joining us today, but many of you know David Lee. And then I'm here with my colleague, Tori Vandelin. Tori, how are you?
Hi, Ashley. I'm great. How are you?
Great. So Tori's going to be providing you with all sorts of links in the text chat and anything that you need technology-wise. So thanks so much, Tori. So if you all are new to Prevent Connect, I want to let you know that we do live in many different places on the internet, not just here in this Adobe Connect room. Oh, thank you, Caitlin. I appreciate that. But we would love to connect with you in some of these other spaces. So we do have a brand new website, preventconnect.org, where you can find recordings from all of our previous web conferences, blogs, podcasts, links to all sorts of resources and tools. We would love for you to get on there and explore. If you have any questions, please feel free to email us at info@preventconnect.org. We also have an email group where there are over 1,300 other prevention practitioners that are sharing information, sharing resources, asking, about successes and challenges. And so if you'd like to engage in conversations around the work you're doing further, that's a great place to do that. And then we do have an e-learning site where you can enroll and take courses related to all sorts of different prevention topics, focusing on sexual and intimate partner violence. And then if you are not following us on Twitter or Facebook, we invite you to do so. We are pretty active on those social media channels. So the technology that we're using today, we are using Adobe Connect, and probably the biggest thing is that we are going to be using the text chat feature a lot, and so many of you are already doing that, so that's great. But we'll be asking you to respond to questions both in polls and in the text chat, and then if you have questions or insights, things that you want to share, we would love for you to engage that way in the text chat. We are so big on having conversation and building connections, and the text chat is one of the ways that we're able to do that. As I said, we will have PowerPoint slides available for you in the coming days. We don't have them available for you today, but we will get those to you, and we'll send out an email when those are available. If you have any trouble streaming this audio over your computer, we do have an 800 number. We also have closed captioning streaming below these slides by our friends at Aberdeen Captioning. And so with that, I think let's do our first polling question. So this should hopefully automatically pop up on your screen, and we just want to know, have you ever attended a web conference before today? So there's a variety of answers. Either you've never attended one ever before, or you've been on a web conference, but this is your very first Prevent Connect web conference, or you've been on Prevent Connect web conferences before. So I am sharing the results, so you should be able to see in real time how people are responding to this. And so for the folks who have responded, you will see that a little over a quarter, this is either your first web conference or your first Prevent Connect web conference. So we're so excited that you've joined us and hope to see you in the future as well. And for those of you, the almost 75% of you who have been on Prevent Connect web conferences, thank you so much for coming back and for being part of this community. So I'm going to go ahead and take that one away, and let's move on. So for the 25% of you who are new to Prevent Connect is really interested in primary prevention. So we're interested in looking at why does violence happen in the first place, and what are some of the solutions and strategies and efforts that we can engage in to make sure it doesn't ever happen? And so we look at not just sexual violence, but also intimate partner violence. And we look at violence across the lifespan. So this includes child sexual abuse. As I said, we're really interested in looking at violence before it's ever even happened. And we know in order to do that, we need to connect to other forms of violence and the root causes. And talk to each other. We really need to connect to other prevention practitioners. Oftentimes, folks who are doing prevention might be the only ones in their agencies, so it's important to create those connections. All right, so our web conference today, we'll be looking at a new tool from VetoViolence, and we're going to be looking at adapting violence prevention approaches. And Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. So we have some objectives for you today. Our presenters are going to be really describing using essential elements to select, adapt, and evaluate violence prevention approaches guidance and the online resource on VetoViolence. We hope that you'll understand how essential elements can be used to improve violence prevention efforts. And if you don't know what we mean by essential elements, you're going to get all of that information as well. And then to be able to really identify ways to be able to utilize this tool in your state and local violence prevention efforts. So I want to introduce you to our guests today, Lindsay Barranco and Kimberly Ferrer, both from Centers for Disease Control and Prevention. And Lindsay and Kimberly, how are you today?
Doing good.
Very good, thank you.
Good. So Lindsay and Kimberly, I know that in some ways on this web conference, we are really revisiting concepts that we've explored on Prevent Connect years ago, but with new tools and resources. And one of those is this document that you all put out on using essential elements to select, adapt, and evaluate violence prevention approaches. And so I am going to drop another polling question in our room because I'd love to know how familiar our audience is with this resource. And so hopefully you all, let me make sure I'm broadcasting the results. There we go. So Kimberly and Lindsay, you can see how people are voting. There are 2 people that use it all the time, so we need to find out who those people are. Maybe it's you 2. But we do have folks who have used it once or twice. The majority of people have never heard of it, but then there is about 30% who've heard of it but have never used it. So this is actually really great because you're going to provide so much information that people won't be able to say that they've never heard of it before after this. So I'm going to go ahead and remove that. And Kimberly, I'm going to pass it over to you so you can walk us through essential elements and what it all means.
Okay, great. Thank you so much for that setup and introduction, Ashley. And I think this poll is really helpful in seeing how we have all kinds of things where we try to bring evidence or evidence-based practices into play, and we put out a document, and then the question is, do people use it? And I think this is what we're going to explore today in the context of prevention strategies. And in some ways, I'm encouraged that there are some folks who have actually used it, but I think it's webinars like this and the work that we do in all of our different practice settings, kind of working with these concepts in a very applied way that really speak to the issues of adoption and adaptation to context. So it's kind of helpful to see right now if people are using it and to what extent. So we're excited to be here. As Ashley mentioned, we have been working a few years with the ideas that we're presenting today in the context of violence prevention, and this originated in a project funded by the Robert Wood Johnson Foundation. And it was really exciting because we got to bring together people who are implementing things in practice settings, people providing technical assistance, and those people who you might call innovators or developers. And it was largely focused and developed looking at programs. And I think one of the things we've added to and enhanced throughout the years is really thinking about the other kinds of strategies that we implement in violence prevention and in public health in general that aren't necessarily programs. So what I want to first start out with is this framework really does build on work that had been building in other fields such as HIV and substance abuse and education even for many years. And so the point here is, innovations are rarely new per se. Rather, they're modifications or adaptations of pre-existing ideas transported from one social system into another. And so we really want to credit and appreciate the work that's come from these other fields. And you may be familiar with it because there's other work that refers to core components or core elements that is very related or very similar to this that we've built on. We have chosen the term essential elements because in our work in violence prevention, the practitioners that we've worked with and received feedback from really relate to that term more than these others. But definitely it's something that is an extension of larger work that's happening in public health and violence prevention. So I just want to start by setting the stage for, where this fits in more broadly, and then we'll talk about where it fits in our work, specifically in the Division of Violence Prevention. I love this formula for success. It's pretty succinct, and I love things in threes. So this is from the National Implementation Research Network, and they really make the point in this figure that it's not enough to really just have effective innovations. You also need effective implementation that's actually happening within enabling context to get at the things that we all care about. And for us, that's really our effective innovations typically are prevention strategies with the best available evidence we're trying to work with. And our socially significant outcomes, or our so what, are really related to our violence outcomes. So I think this is, I don't have to really elaborate on this. We know this is why we do the work and why there's a lot of passion behind the work that we do. But it really is to make the point that it's not enough just to have evidence or evidence-based strategies. And more specifically, we've thought about this in the context of the work that we've been doing at CDC in developing technical packages, and many of you I know are familiar with these packages. We have 5 technical packages across 5 different types of violence that we work on. And what we think of these is really kind of a knowledge translation, which is kind of taking the best available evidence in the science and trying to, in the technical package, describe them or the scientific findings in a way that's understandable, because there's a lot of synthesis in that. And I think the point we are trying to make here in this slide is, while that's necessary, it's not sufficient. There's a whole other piece to getting things into practice. And so hopefully many of you are familiar with the implementation guidance that we developed called Violence Prevention in Practice. And the tool that Lindsay's going to talk about today actually sits within on VetoViolence in this suite of tools. We have another webinar on Prevent Connect where we talked about that. But the strategies that promote the adoption, integration, and scale up of evidence-based interventions in practice, that's really where kind of this work around implementation and adaptation happens. And the point, with the arrow that's kind of returning back to knowledge translation is really importantly that this is kind of the practice back to research if you want to think about it, but that practice is also part of building the evidence.
Great, Kimberly. Well, thank you so much. And there's already some comments in the text chat. Mark saying that it would be really helpful for us to be able to identify essential elements of the few strategies that are evidence-based. And then Marissa had a question. How do the essential elements and the principles of effective prevention relate to each other? And could you say that the principles of effective prevention is an essential element?
That's a really great question.
Yeah.
So when I think about the principles of effective prevention, and I'm thinking about like the Nation et al. Article that we often, commonly reference, I think about those are kind of broad an application of things that have been looked at across many types of prevention efforts that apply to, you might think of sort of the general capacities or the general elements around implementing prevention. Essential elements, I would say, is related, but you might think of it as the innovation-specific part of that. So there are things we know generally about what's effective in prevention, and then the things I think that essential elements get at is within a particular strategy, what are the things that are known to be effective or important in the implementation of those that are likely to impact outcomes for that particular strategy. So others may have ideas about that, but that's my thought. I don't know, Lindsay, if you have anything to add to that.
Nope, I think that's a perfect summary.
Yeah, and I think when I think of essential elements, that's how I've been understanding them, that they're really tied to specific strategies. So that makes a lot of sense. So I think this would also be a good time to hear from our audience. And so we're really interested in hearing what prevention strategies you all are implementing right now. And so if you want to head over to that text chat and just let us know, what prevention strategies are you trying to implement right now? We'd love to hear from that. And I think since we'll give folks a chance to kind of answer that, but we'll keep moving on. And we'll come back and kind of see if there's a theme of what some of the strategies that folks are implementing.
Sounds good. And we can also come back to some of the other questions that people are asking, which are really great.
Absolutely.
So, great. So just to start with kind of a common foundation, how we think about essential elements, which I'll define shortly. This is probably familiar to many, and it really, we have it here just to represent, this work is focused on what we call evidence-based, or in our world, sometimes we use strategies with the best available evidence. Mark makes the point it's a relatively young field and our evidence is building. But that the basic logic that undergirds it is really that there's a set of, it could be activities or strategies. And when we developed this, it was really more focused on program, but that those are really intended to impact short-term outcomes in our world that's often thinking about risk and protective factors. Obviously, we have things that are even more proximal that may be about processes and systems and things in the environment changing, but ultimately, in this very simplified version, we talk about that as reducing risk factors to, in turn, achieve our ultimate goal, which is reducing violence. And when we get into essential elements, we're really like diving deep in this first box of kind of the how. How are we going to actually achieve this through the various strategies? And so we're going to be talking about essential elements as characteristics of this first box here. So what are essential elements? The way that we've defined them is they are the active ingredients of a prevention strategy assumed to be responsible for achieving intended outcomes. And that assumed part is there because it really is using the best information we have to be able to identify essential elements. And often we may or may not have empirical data to support every one of these essential elements. But what we're going to go through today is a really practical approach of trying to identify or estimate these. So
great. So I'm going to turn to Tori. And Tori, what were some of the things that folks are implementing in terms of strategies?
Thanks, Ashley. So I saw a lot of things come up in the text chat from you all, so thank you. It's always fun to keep up with it when it's super busy, but I appreciate that. There are tons of you implementing stuff that are implementing programs that are from the Centers for Disease Control and Prevention technical packages, both from Stop SV and from Preventing Intimate Partner Violence, too. Things like coaching boys into men, athletes and leaders, shifting boundaries, safe dates, green dot, all of that kind of stuff was coming up, too. I also want to give a special shout out to Jacqueline Cortez talking about teaching public health and prevention concepts within our agency and applying prevention concepts on college campuses. So not just working on prevention out in the community, but working on prevention within our own agencies. So thank you. And I also saw some folks mention some prevention strategies they're doing within the community level too. So looking at social change campaigns, increasing access to paid family leave, and creating protective environments. Lots of information in here about engaging influential adults and peers and engaging boys and men. So Ashley, did you see anything else come up in the text chat?
I mean, there is so much, Tori, but I think you did a good job of gathering that. So thank you. So I know that sometimes the way a program comes to us doesn't always work in the context of our settings. And so kind of building on the strategies that you're implementing, what are some of the important considerations that you take into consideration when you're making adjustments in your programs or to your programs? And so we'd love to hear from you again, folks in the audience. What are the important considerations in making adjustments to your programs? So what are some of the things that you think about in terms of a program or maybe a curriculum that, you just need to tweak it a little bit for whatever reason? What are some of those considerations? And so we'll go ahead and do the same thing, Kimberly. We'll let folks identify those and we'll return. But why don't you talk to us a little bit about identifying essential elements and what that looks like?
Sure. And I'll just touch on the highlights. In the guide itself, there is some elaboration on this, and the way that the guide in the site are designed is to there are a lot of worksheets and ways to kind of apply these different concepts to whatever strategy you're working with in your context. But just to kind of anchor us in thinking about, how to identify essential elements in a world with a lot of uncertainty, really just trying to use the tools at hand that we have, and those differ depending on the strategy and the circumstance. But in general, and not just in the work that we've done, but this is really representing more broadly what's come out of kind of adaptation work that's been published and also shared in practice settings. There is what I mentioned earlier, is like empirically testing strategy components or elements or adaptations. And usually when adaptations are tested, it's really a whole program or strategy adaptation. Sometimes they're called cultural adaptations, and they're made prior to implementation. So that's one approach. People also use theory, social and behavioral theory, and as well as the theory of change. So when we looked at the logic model, you can think of that as a type of a theory of change. And I'm going to actually walk through an example of another kind of more conceptual theory of change. But that's another thing that's used to inform the identification of essential elements. And then we get to actual implementation. And so a lot of the work that we did in our project was working with our funded recipients and having them collect information on their implementation and adaptations and the reasons why, and then bringing that back together with TA providers and developers. And then, of course, another approach, and these can be used in combination or whichever ones are feasible to implement, there is usability testing after an evaluation study. So this is really after a research study, evaluation study, potentially kind of testing implementation with other groups or the usability of a strategy or program. And just a little bit more about that. So those are different methods. We really think of our approach as a practical approach to estimating essential elements. And so some of the things that we talk about is reviewing and consider what is known about the essential elements of your approach. And that could be a program, practice, or policy. And this really means thinking about kind of what information is available, whether if it's a program, there may actually be implementation guidance provided. There certainly is likely to be objectives and content that can be reviewed and information on delivery. Though you can refer to the approach's logic model, and as I mentioned, materials and other documents that really connect the actions with outcomes. And then certainly seeking input from others who have experience with the approach. And I think this is really relevant. We'll talk about an example that's not a program later. So experience with those who bring experience to this in different contexts are really important.
So Kimberly, before you go into the essential elements of a program, I just wanted to highlight some of the things that were coming up in the text chat, because there were a lot of themes in terms of considerations around language, around the audiences that programs or strategies were kind of originally developed for, and so folks are really thinking about them in terms of accessibility and inclusiveness to different identities, cultural adaptations, what's going on currently, so current events, how do you bring current events into your programming, and I think, gosh, that especially has been relevant in the last couple of years, I would think. And then finally connecting and incorporating that program with some of the other strategies that you're implementing. So I just wanted to highlight some of those and let you know that those were things that people are really considering.
That's great. And I think that some of our experience in working with different groups and in our own kind of search for how to really implement and work with evidence-based programs and other strategies, I think are really reflected here. And I think some of the examples we'll go through will also reflect some of the things that people are mentioning. And full disclosure, we're not necessarily offering the answers. What I think this approach speaks to is a way to consider these different contextual circumstances, so the local setting and the things that come up during implementation, and a way to think about that to really kind of balance what we'll talk about in terms of fidelity and flexibility. So I'm probably getting ahead of myself, but that was a pretty rich text chat, so I did want to speak to that. But I'll move forward and get to that. And so just to dive a little bit deeper in program essential elements, we really think of it as the what, how, and who. I think that that's easy for us to remember. And when we're talking about programs, so by programs, I mean typically like a manualized curriculum. The what is often, the knowledge, skills, and messages delivered through program activities. So that's, pretty apparent in a lesson, a set of, lesson messages and objectives. The delivery or the how are often the instructional methods. You can say the pedagogy or the delivery, timing, and logistics. And then the who often is an actual person who's facilitating or an entity that's delivering the program. And in some situations, we might call this person the messenger, but those are really how we define it for programs. So I want to talk through an example that illustrates a program that has applied this. And this is Youth Empowerment Solutions, which really was originally developed by the University of Michigan, led by Mark Zimmerman and his team, that was first developed to address youth violence and now has been more broadly applied, including by potentially some folks who are on the call. And what I wanted to point to here earlier, I mentioned kind of a theory of change. What undergirds Youth Empowerment Solutions is empowerment theory, or an empowerment theory that was really developed with adolescents in mind. And they talk about kind of these three different areas, and in lay terms, it's really the feeling, the connecting, and the doing. And the idea that empowerment for young people really happens through these three kind of main avenues that work together. And what I'm about to walk through is how this then was applied to thinking about it through essential elements. And that's the work that we did in partnership with the University of Michigan and 5 of our recipients who are implementing YES in their context. So here, this kind of illustrates, this is the guide that they ultimately developed, and this shows you how at the time we were using the term core components, so to my earlier point, things evolve over time, but this really gets into how the essential content was defined. So this is the feeling concept here. And what you can see is in the picture on the right-hand side, that's the table, really the main ideas are, or topic areas you could say, are laid out, are specified. This is the important content and why it's important. And then it actually, in this case, talks about, well, where you can find it, and yes. So the reason that everyone really felt like this was important is to really kind of make explicit the rationale. Why do I need to cover these topic areas? So that you can then understand if for some reason they aren't covered, how it actually plays with the larger picture and what might be missing from that larger picture. And then here are just the other 2 areas of the connecting and the doing. Again, it's sort of the same idea of kind of laying out, well, what are the main topics that are covered and why and where they're covered. For the delivery components, or the how, this was something that our 5 recipients who are implementing YES were really important. And I really want to make this point. While the developer had an idea in mind from the original implementation and some subsequent implementations, this was really our recipients, who I think of as like the early adopters, our implementers on the ground, really informed the essential elements for this. And I think in part that's because it's hard in a single implementation in a particular context to envision all of the ways that things could play out. So some of them were to provide a safe and consistent physical setting and routine, to reduce barriers to attendance, and there are a number of ways that they suggest doing that, to create and maintain positive group norms, support and encourage lively group interactions. And then there was a point to implementing sessions in order because they do build on each other. But I think my favorite is to take advantage of serendipitous opportunities. And I believe in one of the earlier comments, or maybe it was something you mentioned, Ashley, this idea that these are being implemented with young people who may experience things in their day-to-day lives that are fairly traumatic. And I think an example that they actually have used in their past work is when there is an incident involving gun violence. To really, for one, it's not necessarily helpful or sensitive to just go on as planned, but it also is an opportunity to really reinforce the concepts of yes in a real world event that's happening and that these young people are processing.
Mm-hmm.
And finally, it's the who, which in this case, there is an adult group leader, and there are some essential characteristics. And we always say, and it seems simple, but and obvious, but one is really the facilitator has to like young people. And it's very interesting. Some adults aren't crazy about working with young people. So that needed to be made explicit here. And also interested in helping these students succeed, to have some working knowledge of the principles. There were things that became really important around just management. And then for the community project, to really pick neighborhood advocates that had a strong desire to see these young people succeed.
Kimberly, so we had a question from Melissa that I think ties to the who, so I just want to bring it up to you. So Melissa asked, where would tone or values exhibited by the facilitator go? We have found this to be really important in program implementation. And so it sounds to me like that would be part of the who.
Yeah, that's such a great question, and that actually is part of this. So coming up will be some examples of like how to evaluate that, because I think one of the challenges with thinking about like an attitude or tone that you bring to a situation is how do you actually operationalize or define that in a way that you know it's there when it is happening, when a particular kind of attitude, for example, that would be encouraging young people to take leadership roles versus one that's discouraging a tone or maybe not allowing kind of organic conversations to take place. So I think that would fit here. And it's a good opportunity to also make the point is like, this is really just a way to help organize this information. It's not so important that it goes under the right label of who, what, and how, but I think it's helpful for people to have that breakdown. And like you, Ashley, I would put it under the essential group leader characteristics.
Great. Thank you so much, Kimberly.
Sure. Okay. So those are programs, and the next thing I want to talk about is a lot of where we're going in our work, or we're there, I guess, doing this work, which are other kinds of prevention strategies. And we've thought about this, and I think this is hard to articulate in exactly the same way as programs. And so what I'm going to share with you is where we're at in our thinking around it. I think it's evolving as we have more experience with different kinds of strategies. And it's really an area that there's a lot of work needed from an input from the field about how to really talk about this and shape this. But I'll share where we're at now. So these are kinds of things. They might be things happening in social media campaigns. There's a lot happening around community mobilization or community organizing in some cases, policy implementation and environmental changes. And in that case, things may not or likely are not manualized. They may be more diffuse. So thinking about the what, how, and who, I think is still really relevant, and we have found in our work extremely helpful, because the idea is that you want to be able to communicate what you did or are doing that could be transferred to another context. To make that public health impact, it's really, how do we spread this idea if it's a good one? We have to be able to tell people, articulate what, how, and who. So, but it may look different. And so it may be messages if you're doing social media or media campaigns. It could be design elements, particularly for like built environment changes. It could be articulating components of policies that are being implemented and their application in a context. The delivery may be really an overall approach. So sometimes you hear people talk about best processes versus best practices. It might be a set of guiding principles or a method. And then the implementer may be not a single identified implementer, but it may be opinion leaders or community leaders or even technical experts that are guiding a process along. So here's an example that may illustrate some of this, and this is a cleaning and greening example. And many of you are probably familiar with greening as a strategy. I know Prevent Connect has hosted a webinar on greening as a prevention strategy. And I think there are a couple of things about it. One is it's not necessarily one single thing, and the evidence is sort of evolving around it. There are different ways to approach greening and cleaning. And so here you can see illustrated, these are different types of environments where that may happen. A lot of the work's happened in vacant lots or on different verges, for example, parking lot verges or any place where you're distinguishing one kind of type of property or land from another. And so in this case, the what may actually be the design elements. The how may be kind of guiding principles that are evolving as different studies come out, and this is being implemented in different ways. And then the who may be more like community leaders who organize activities and resident volunteers. And I'm going to come back to this example throughout to illustrate some of the other concepts that we'll cover. First, I was pausing just to see, Ashley, if there were any other questions or things you wanted to touch on before I turn to fit, or I could keep going.
Well, I will just say, Kimberly, that so thank you so much for going through that greening example, because Carrie did have a question about, what about strategies that are policy focused? How do we determine essential elements for a strategy like that? So you really just answered that, some of the thinking from you all around that. And so, yeah, it worked out really well.
Great. Well, thank you for that, but I don't know if I exactly answered her question, but I do want to say in the violence prevention and practice, and maybe Lindsay, if you want to add here, I think one of the ways that policy often kind of articulating the how is really looking at how this has been implemented in other states or in other cities, and it emerges over time. So for policy, sometimes it can be more challenging in the beginning to articulate that, but I hope that the greening example at least did illustrate kind of an overall approach to thinking about that. All right, so moving on. So we think about essential elements can definitely help really define what a strategy is, and then moving to actually using it. And one way is to really looking at the fit of a program or a strategy. And this sometimes happens before strategy selection, so that's great. But it can also happen after a strategy has been selected, or in many cases, you're receiving funding to implement, a set of strategies that are somewhat predetermined. And it's a great way, and we'll talk about this coming up, to think about it after a strategy has been selected. But let's start with just some of, kind of at a high level, using essential elements to assess fit and how that might actually work. And so one way is like thinking about the essential content or what's being covered, and does this actually fit with what a community needs or what a community is seeking to have in place or address. And I think, for a program, it may really just literally be the content of that, but it could also be these other kinds of things like the messages or the design or the the overall, design elements. For essential delivery, that's often really important, and there's, of course, a lot of work on readiness and capacity, but thinking about and implementing organizations' capacity and resources, or a community's capacity and resources, if we're talking about using volunteers, for example. And then the essential implementer characteristics really gets back to some of the things that I touched on earlier, and some folks in the chat box pointed out. These are the things that really we're looking for people who are either going to literally facilitate a program or guide a process. And they can be articulated in skills, values, or readiness. I like the addition, and I can't remember if it was Melissa, I think, adding, it can be a tone or approach. I think values is kind of consistent with that. So returning to the example of yes, we kind of went through this with them, and the way that it manifests, and this is part of their implementation guidance, is really thinking about from the beginning, before people select it, is it right for you? And so they really articulated, how to think about if this is even a fit or not, and thinking about the essential delivery and what it takes. And I think it's really helpful. Again, this was really informed by implementers and the reality, on the ground of what it takes. And one of the great ways that they used it is they developed a pretty simple organizational capacity assessment, which is just a set of questions that you can answer yes or no to. But what I want to point to here is this capacity assessment really is the application of the essential elements that they defined in the how. And so the guidance isn't, either you're in or not, but it's if you do answer no to any of these, they are considerations in preparing for implementation. So it really makes it concrete and very applied to this kind of specific program. Similarly, they articulated it in the who, or the essential implementer characteristics. And some of the things that really, and particularly the at different positions or types of roles that people would play, whether you're a program manager or the leader or the kind of neighborhood advocate you're working with. And again, it's simple, which makes it more feasible, and it provides people information without telling them that you have to have these things of really what a good fit is. So let me pause there again, just to see if there's anything, any questions that have come up, or I can keep moving.
So Patricia had a question, Kimberly, going back again to strategies that are not manualized, but that, may be really based on partner building as part of that strategy. And so would partner building be an essential element to maybe a strategy like policy development, or even I would think the greening strategy would require a lot of partner building?
Sure. I mean, I would be curious what others think in the chat box, but I would say that if partner building is integral to actually being able to implement it effectively, or in some cases, like the greening strategy, you may not call it partner building, but like community engagement is foundational to the work itself. And in some work around greening, they've shown is really the driver around increasing community connectedness. Then that absolutely, that would be considered, it would potentially be considered one of the activities, but I think then the articulation of the who, what, and how of partnership building would definitely come into play.
Got it. Thank you.
Sure. So I'll just keep moving. I have some examples to get through, and being mindful that we've gotten such great comments. I'm probably going to kind of move through the next few slides, and then the example. And I know we have another poll coming up, but I'll probably go through those again before I pause for additional comments, just to make sure we get through everything. Okay, so this slide really is the balance, fidelity, and flexibility. And fidelity has been defined in many different ways, really from, literally remaining faithful to the original intention and implementation, which may be the full implementation, or doing it as an original developer describes, versus flexibility. And we really think of fidelity as maintaining essential elements, whereas flexibility is allowing for adaptation.
Cool. And we have another question for the audience, just based on the last text chat question that you all responded to in terms of the considerations that you listed. And so now asking, what adaptations have you or would you implement based on those considerations? So we'd love to hear your response and see what you all say. So Kimberly, we'll let folks respond to that, but why don't you go ahead and move on and talk about what program adaptations even are?
Sure. Let's see here. Okay, so when we talk about adaptations in general, we're talking about changes made to an evidence-based strategy, and this could include additions, deletions. Those often are referring to programs, but they could refer to other strategies. But any modifications and reordering. And just a couple of points about how adaptations have been framed, and in our own experience. There's those that happen before implementation starts, and I mentioned one big type is really like a full program or cultural adaptation. Ones that I think are the most common are really during implementation. And some people think about these as our surface level things that may not matter to adapt, and then there are deep level types of adaptations. And there are different dimensions to those, but I think we really, and I wanted to point to this, but we really kind of do think of it in that essential element frame. And so the deeper level adaptations would be getting at changing things that are essential elements. In our own work, we found, and again, this is what we've, our work studying in a program implementation, common reasons were to increase participant understanding. So facilitators were making changes to make lessons more relevant for participants, definitely to maintain relationships. So, and yes, one of the big things that we learned is implementers were adding some relationship building activities at the beginning, because it's a pretty intense topic to be covering, to be young people talking about their lives, and they felt like they needed that to respond to limited time and resources and to fit within practitioner teaching style and approach. And I think this is very similar to other studies. We found the most common type was modification to delivery or the implementer, but also additions and deletions to content and changes in sequencing and timing. And the framework that we used for evaluating adaptations using, it says here core components, but that should be essential elements, is really this red and green light framework. Really where green light adaptations maintain essential elements and may improve fit and usability. So that's considered green. And red light likely to compromise essential elements or alter how they work together. And this is really a framework, again, to make practical judgment calls. There are no real absolutes here, but I think we found that people find it really helpful in discerning some of these decision points. We, at one time, had a yellow light, and then we found, most of us, everything could be yellow light, because on the one hand, it is, and on the other hand, it may not be. So we actually just have retained this. But just to acknowledge, a lot of things are in that kind of yellow light area. And I'm going to go through an example. Some of you mentioned coaching boys into men, and then someone also asked about, could we do this work with some of the strategies that we have? And we've tried to do that, but there's a lot more that we could do in working collectively with developers, implementers, et cetera, in doing that. But here's one example where we worked with Futures Without Violence. And I know Prevent Connect has at least one, if not a couple of webinars that actually also with Futures Without Violence that talks about this. So Coaching Boys into Men, for those of you who aren't familiar with it, is a card series that's intended to be implemented within a sports season and working with originally male athletes. This now has been adapted to all kinds of sports and all kinds of populations, as well as different implementers, but initially was developed to have coaches implement throughout a season a series of cards that address violence, and starting with peer violence, and then also having increasingly more topics related to girls. I think one of the critiques of Coaching Boys into Men that Futures has really taken seriously and has led to additional adaptations are, things that people have mentioned that are heteronormative, or things that are specific to one group but may not apply. So in some ways it's a perfect example, but it's a perfect example of what happens when this is being implemented in the real world. Here's its logic model. So you can see it has a series of activities that cover these various topics with the intended changes or short-term and intermediate outcomes of more of the risk and protective factors around recognizing behaviors and promoting respectful behaviors that hopefully will lead to a decrease in dating violence. So these are examples of the essential content. So we went through a whole process with Futures Without Violence and working also with the University of Pittsburgh and many coaches around the country, and in particular in the Pittsburgh area. So one essential content message is disrespectful or abusive behavior can occur in person or in digital spaces, and it takes many forms. Delivery components, coaches facilitate 12 discussions over the course of at least 6 weeks and no more than 2 per week. And that it's intended to be interactive, to use real life examples, and to really engage athletes in this work. Not surprisingly, implementers are dedicated to building a strong relationship with their athletes based on trust and respect. And I think that's where this program started when it was a media campaign, as coaches are a natural fit for that, although other types of implementers have now worked with it. So in the process of identifying essential elements, Futures they actually adapted the red light, green light to an adaptation tool that talks about foul or fair play, because that's relevant to their sports context. And it was really cool. It took the essential elements and identified some common kinds of adaptations that may or may not be, or may work or not. So fair or foul play. So this is a question for you. A coach who is accustomed to lecturing his team on sports strategy decides to skip the discussion portion of a training card and lecture the whole time instead. So is that fair or foul play?
And I just dropped.
Sorry. I kind of gave away the...
It's okay. We're going to see what folks think. I'm broadcasting the results, Kimberly, so you should be able to see how it's looking.
Yeah.
All right. I'll remove that. Most people are saying it's foul.
Yeah, and that's what Futures landed on. Let's see. Sorry, let me get to it. because it is meant to be interactive to keep athletes engaged. And, the theory being there's a better chance that athletes will learn and remember CBIM messages. So again, these aren't absolute, but it was a decision point that in general, this is really the main kind of delivery method of this. Okay, there's one more and I'll keep it here. A coach tells a personal story about being bullied in middle school to emphasize the CBIM message that insulting language can be harmful. So is that fair or foul play?
And there you go. You should see the poll. It looks like of those responding, folks are saying it's a fair play.
Yeah, and I think they would agree. And the point I want to make here is that's within certain bounds, that the story that they're telling stays on point and on message. So there are examples of coaches using stories that include some form of violence, like pushing someone or punching someone, and I think that they would call that foul play. But in general, the idea is that that is part of the delivery. I just want to quickly, we integrated this in here to touch on how you can really use essential elements in designing implementation evaluations. And I'm not going to go in depth here. I'm really going to show you a series of examples, and there, some of them are actually in the guidance, and other are tools that have been developed using that kind of general frame. But this one here, and I believe this came from Yes, is really articulating kind of the essential element in terms of when it's in place and when it's not in place. And this has been one of the most, we get feedback, useful frames because it really makes concrete. And getting back to that question about tone, how do you really operationalize that? Well, I think there's, this can be helpful in getting closer to the idea of, well, what would that look like if it were actually happening? And what would it, look like if it didn't? If a teacher treated students with respect, listening, and allowed them to participate versus maybe cutting them off or being rude or short. So this is one way to actually, you could design even a fidelity instrument, or to look at, are the essential elements that may be kind of less tangible, are they actually in place? And so we have tools in there that kind of provide some general guidance like this to show that. Another way that this looks, and we have this example, is a positive versus negative behavior of group leaders. And then finally, there's a tool in there that helps with just actually tracking adaptations. And one more time, I'll return to the Yes example, which they actually use this to track adaptations during the implementation we worked on with them. And I think it's really helpful to help people reflect, was it successful, and why was it successful, and will you actually maintain it? So it's also a way to have like ongoing implementation improvement. So just to return to the greening example, we kind of talked about the different what, how, and who. But to further articulate that, and in thinking about, okay, how would I apply all of this? I just went through kind of what it would look like for a program. Well, for greening, the design elements could be articulated. These are some that have been part of greening. Green lots should provide a welcoming look that clearly identifies the space is open to residents. However, there are borders, and borders should delineate public and private space without creating dense or blocked areas. Spaces should include features that promote community connectedness, such as a play space, benches, and community gardens. So this is, something, at the point I want to make here with this example is it's something that may evolve over time, just as it has in programs historically, but that they can be articulated at this level, and how really, in this case, the guiding principles of how people come together as residents and collectively make decisions, as well as residents actually participating in greening activities. And this, there is some research that supports this, where they had landscapers versus the community residents, and of course higher community connectedness when the residents themselves were doing it. And then the WHO, community leaders and residents, this articulates some of the characteristics of those leaders. They must think it's legitimate, sort of have it, an orientation to it, and that the residents, should be motivated to participate and come together for these activities. So I'm going to suggest, because we want to get to the tool, that we're going to ask about this as an adaptation, but I'm going to actually move through this so that we can get to the tool in the time that we have. But I think what I do want to make the point here is, when you have something like greening, or even maybe a policy where you're still defining the essential elements, it's even harder to know if it's an adaptation, because it may just be a natural variation in kind of a strategy that's being implemented. And what I mean by natural variation is there may be multiple components or multiple approaches to that single strategy like greening that are still being articulated, and so to call it an adaptation or not may be challenging. So our approach is to not get stuck in that, but to really still use this to think through why some of these different elements would be important. So it's too bad that we don't have time to go through these, but again, I really want to make sure we get to the tool, and we've had such good engagement that I think it was time well spent. So here's our takeaway. That really essential elements are assumed to be the active ingredients of a prevention strategy. That's why we care about it. We want to, have things spread, and we want to create, public health impact or impact on our violence prevention. And understanding the internal logic and using essential elements to do that can facilitate adaptations that don't compromise outcomes.
Thank you so much, Kimberly. That all is such important information, and a couple of people have said that's so relevant and timely to some of the strategies that they're working on and thinking about. So Lindsay, we'd love to go to you now and hear about the resources and the new tool that's available to folks.
Great. Thanks, Ashley. All right. So I'm excited to just kind of hopefully pique everyone's interest about our new online resources for folks that haven't seen them yet. First of all, hopefully most folks are familiar with violence prevention and practice. Kimberly mentioned it earlier, and we do have a whole adaptation section on violence prevention and practice. And the adaptation section really kind of pulls some of the key elements out of the Essential Elements Guide, the key points out of there, and talks through some of those different factors that Kimberly talked through, and has a lot of valuable stories and links out to additional resources. So that's sort of more of a traditional online guidance, but we also recently this summer released the Select, Adapt, Evaluate tool, and we're really excited about this because it provides a more interactive way to learn about essential elements. So this is something that's great that you can kind of share with your partners if you want them to understand more, or folks that maybe aren't going to be as interested in reading through all of the guidance. So I know that you just put up a poll, I think, Ashley, right?
I did. So you can just see quickly how, the majority of folks who are answering have never heard of the tool, but some have heard but haven't used it. And there's 4 people who have already used it. So thanks, everyone.
All right. Thanks for those 4 people. Okay. So the link is down below that you can also always get there through the VetoViolence website. Folks may have noticed that Veto got a redesign this summer, so it looks a little bit different, but you can always find Select, Adapt, and Evaluate by going to the Tools and Trainings section. And there's lots of great resources there, so I encourage you to explore. And I just wanted to highlight a couple of the different features of this tool that we're excited about. So the tool really is designed to be a more interactive way to go through a lot of the steps that Kimberly just walked you through. So really understanding kind of how to estimate essential elements, how to assess the fit of different policies, practices, and programs, and when to make adaptations and when maybe to keep the original intent of a certain program, practice, or policy. And then finally, I think the really critical piece that we like to stress is to evaluate your adaptations as well. And it's a really exciting, we are very excited about just the interactive nature. So for example, here's an example of where you can kind of click around to see, the definitions of the different who, what, and how for both programs and community and societal level approaches. We also tried to include a number of different concrete examples throughout the tool so that you can sort of look at, what are some of the different essential elements, both for programs and community and societal approaches, and what are some real-life examples of those. And we finally tried to include also some knowledge text too, because everyone likes a little quiz. And so looking at, similar to kind of what we did in the webinar today, being able to kind of go through and test your knowledge throughout. So as I mentioned, this may be a great thing to share with your partners or folks that you just want to become a little more aware of adaptation, or if you just want to learn more and kind of get a little more experience with it. What I did want to mention as well is both on violence prevention and practice and in our new online tool, all of the worksheets that are in the original Essential Elements Guide are available to download and to fill out. So if you want to download this and fill it in and save it and use it with your partners, you're able to do that. So all of those are available online so that you can actually use them with your partners, with the folks that are implementing the programs. And I think, Ashley, I'm going to turn it over to you.
Thanks, Lindsay. So I really encourage everyone to go and take a look at that new adaptation guidance tool on VetoViolence. I love the interactive elements. It's so cool that, not only are there some really great examples and knowledge checks, but that you can download and fill out worksheets, and it just makes it such a usable, helpful tool. So if you haven't checked it out, I hope that you will go and do that. We really want to know, how in the brief time that we've had together today, and now learning that there's a tool where you can actually continue to build your knowledge around adaptation, how are you planning on using this tool to strengthen your prevention practice? We'd love to just hear that. I should have said at the beginning, but we were running a little bit shorter on our web conference day. Typically we go for 90 minutes. Today we're going for 75 minutes, and that's really because there's a lot going on for a lot of our audience members today, so we wanted to give them a little break in time. But I will say that, these are concepts that we've, as Kimberly and I both said, we've been looking at them for a couple of years, and we'll continue to look at them and explore them in our web conferences. So this will not be, the last time, clearly, that we're going to be talking about essential elements and adaptations. But we'd really just love to hear how you think you'll use this tool moving forward. And I see that, Jenny, thank you. You're going to use it with your youth advisory team to determine your best approach to some of your project planning, identifying essential elements for your prevention program. And so using the tool for a group discussion, even continuing to have conversations, especially I think with some of the strategies that folks are working on that are, as Kimberly was talking about, non-manualized. And so there's some additional thinking that needs to happen. So I want to just, Kimberly and Lindsay, I just wanted to turn it back to you all if you have any closing thoughts or comments.
Thank you. I wanted to point out that, and I see our colleagues from Ohio, Rebecca and Sandra, and colleagues from California, Mina, have used this, and we've done some work with them to think about more practice-based strategies. So this work all developed from, evidence-based work and identifying kind of the essential elements Obviously, we didn't have time to cover it today, but it is something that we are doing and exploring, and I hope we can come back to, is how to actually apply this to help articulate the things that you are developing in practice and may try to promote it being more ready for evaluation or being, able to develop kind of implementation guidance. So that's one way I hope that it will be used in the future.
Thank you, Kimberly. Absolutely. Lindsay, did you have any closing thoughts or comments?
I don't think so. I just wanted to share our information. So if folks have questions about essential elements or the tool, there's our information. And I think to reiterate what you said earlier, Ashley, that we will hopefully be sharing these slides for folks that are interested. And we always love to hear kind of how folks are using the tools in the field. So thanks for sharing that today.
Great. Well, thank you both so much for joining us and for sharing all of this information that, based on the text chat was really useful. It's been a great conversation. We will be sending you all that have registered and attended follow-up correspondence when those slides become available and when the recording becomes available. If you have any questions or need anything before then, you're welcome to reach out to me. But I just want to thank you all again for joining us today. I hope you have a wonderful rest of your Wednesday, and we look forward to seeing you on a future Prevent Connect Web conference. Take care.
Thank you.